All right, welcome back, everybody, to another Facebook Live tour. Today is brought to you by the Ryan Health WIC program. It's Raina again. I'm behind the scenes. You won't be able to see me today, but we have Ryan Health WIC's director, Helene, here today. Helene, introduce yourself to the audience.
Hi, everyone. My name is Helene Rosenhaus-Romeo, and I am the director of WIC and also clinical nutrition here at Ryan Health. So today you're in our beautiful new WIC site, brand new. We just opened, and I'm excited to give you a tour.
How exciting! Can you tell us a little bit about WIC?
Sure. So WIC is a federally funded, which means the money comes from the federal government, supplemental nutrition program. It is the only nutrition program in the entire country that provides nutrition education in addition to an actual food package.
Nice. All right, let's take a look inside. But before we go, what does the sign say?
Oh, I'm glad you pointed that out. WIC is a designated voter registration site. So what that means is if you have an address change or you newly become eligible to vote, you can register here. We will take care of the application for you, or we will give you the application and you can mail it at your own convenience. But it's a great way to make sure you're registered for the election.
Oh, sounds good. Let's take a look inside.
Sure. So our first stop here is our waiting room. So the family comes in and they would first just introduce themselves with our lovely nutrition assistant, Paloma. So she would check ID, check their appointment. We take walk-ins, so even if you don't have an appointment, we are happy to service you. So she would take the information, they would have a seat, and then they would move along the progression, and I'll show you some more about that in a minute. But first I want to show you our wonderful multi-purpose office here. So this is a place where we'll have our breastfeeding groups, our child education groups. We might have some staff meetings here.
Look at that window.
Yeah, isn't that lovely?
All this natural light.
It's so wonderful that we're street level. So we've already had lots of people come by. They see us and they want to know what's going on in here. No schlepping in elevators, which is great. So,
what types of groups will you have in here?
So good. We typically, one of our most popular groups is breastfeeding groups. So we do that virtual, but we also have an opportunity to do that on site. So bringing expectant mothers together, new mothers for the first time, everybody's sharing their experience. So that's something that we absolutely could get back to. So
Nice.
Child nutrition groups, so children as well.
And are these classes free of charge?
100%, yes.
We love free.
Yeah, there's no charge for WIC. And when we go down, I'm going to talk with you about the services that WIC provides. And if you had to pay for this outside, it would be a lot of money.
Yeah.
So you get the benefit of nutrition experts, lactation experts, all free of charge.
We love free.
Yeah, exactly.
Oh, I can't get over all of this natural light in here. So gorgeous.
So Rena, there is different components for eligibility. So this is where staff, nutrition assistants would conduct an intake. So they would do residency eligibility, income eligibility. So you do not have to be a citizen of the United States. You just need to show that you reside in the state that you are applying, because I said it's a national program. So here we would just want to see that you can prove that you live in New York City, New York State, actually New York State. We take people from all over the state, and that you have proof of ID and income. So WIC is a program you could be making as much as 185% above poverty. And what does that mean? That means it's federal guidelines, so you can look at that. But if you have Medicaid or food stamps or TANF, you are automatically income eligible.
Sounds good.
So in here, this is because WIC is a public health program. So once we verify categorical eligibility, so you need to be either a woman who is pregnant, a woman who is given birth within 6 months, or a woman who is breastfeeding within a year of delivery, a child up to age 5, or infant. And if you're, for the men out there listening, you are not excluded. While you couldn't be a participant yourself, you absolutely, if you are the caretaker, the sole caretaker, or kinship, grandma, grandpa, if you're listening, foster moms, dads, if you have a child in your care who's under the age of 5, they are WIC eligible. So please don't, just because it says women, infants, and children, doesn't mean that the caretaker, if you're other than that, you absolutely should bring your child in and apply, and it just means that you yourself wouldn't be on the program. So this is where we we get heights and weights. So this is our recumbent. So anybody under the age of 2, we do that lying down. Anybody over the age of 2, we do that standing up. Mm-hmm. We take height. And also because, again, it's a public health program, we're doing screening for anemia. So lots of times people have no idea that they may screen for anemia, and there are key points in a child's life where we want to know that, and a woman's life, whether she just gave birth or she's pregnant. These are vulnerable times. That's why this program exists, to ensure that we are catching people at risk and providing that extra nutrition, that extra support. So that we would do a finger stick, don't worry, it doesn't hurt, right here, and we'd be able to give you the results immediately. Let you know, it's just a screen, it's not diagnosing, but we can talk about ways to boost your iron levels through good nutrition, or making sure that you're getting the care that you need, referring to Ryan Health.
What are those forms right there?
Oh, yeah. So these are 2 forms that WIC uses. This one is called a WIC referral form. So if you're going to a doctor, whether it's Ryan Health or outside, your doctor, you would ask your doctor to complete this for either the child, the woman, or the infant. And we would take this information and screen it. So we would not at that point do a height, weight, or blood, because we would have it. So this is super, super helpful, but it's not a deal breaker. Don't delay coming in because you don't have it. We're happy to do those things for you. And this is a form. We have people on our program who have very special nutritional needs. So it could be anything from prematurity to some, other more complicated food allergies, kidney disease. So this tells us about what your special needs are. And then in our food package, we could offer medically needed formula or nutrition supplement for to help with this medical diagnosis.
Question: the special formula you just mentioned, is that something that would have to be paid out of pocket for because it's not on the normal food package program?
Yeah. Great question. No, WIC is a supplemental nutrition program. So anything that you receive in the way of nutrition counseling, lactation support, or food is completely free. There's no fee for anything that we provide.
Yeah, I know special formula can be very expensive and overwhelming for a new family to process. So that's great to know that WIC is a champion and can provide that service as well.
100%. Yeah, we're here to support you, and you're right. It can be devastating if you have a highly specialized formula. Yeah, and just as because we are connected to Ryan Health, if you happen to be a patient of Ryan and you don't have this form, we can go into ECW to the medical record, and we can see, oh, your pediatrician just did that, or your OB just did that. We can get those results from there. So that is a great advantage. But again, you do not have to be a Ryan patient to come to Ryan Health. So we're going to go to another room now. Come with me. So this is one of my favorite rooms. This is the breastfeeding room. So we have this big, lovely chair. So while it is the law that women can breastfeed anywhere they want. Some women may choose to have a private spot to breastfeed. So for those women who want to breastfeed, can come in, get cozy. If they're with another child, bring their other child, sit here. We have lots of information. We might offer lactation support in here, meaning let's say you have a brand new baby and your baby isn't latching, or you have a little bit of, concern. This would be a very good spot for us to address that. And we do have certified lactation experts on our team. So WIC recognizes that breastfeeding is the preferred means of feeding your baby in line with the American Academy of Pediatricians and CDC. However, we understand that not everyone is able or wanting to breastfeed, so we offer support for that. However, if you are interested and you need the support, we are here. And I can't tell you how many women thought they weren't going to breastfeed and how many women ended up breastfeeding and loving it. So ask us questions. We're here to help you.
That's really cool. Do breastfeeding moms and families, do they get different food packages?
So glad you asked that. So if you are an exclusive breastfeeder, the woman will get a lot of extra food.
And what does that mean, exclusive
So
breastfeeding?
exclusive means that you are not offering supplemental formula. So there's a lot to talk about, but I'll just say in that first 30 days, that's really the time for establishing milk supply. So if you're worried about what's down the road about going back to work, just take it one day at a time. If for that first 30 days, you can establish your milk supply, you'll be on your own. So if you are not supplementing with formula, the woman is going to get extra grains, extra protein, $49 a month in just fruits and vegetables, in addition to canned fish, and whole grains, so a lot of food, and an exclusively breastfeeding baby. That means up until age 6 months, they too are not getting anything additional because you don't need it.
Mm-hmm.
But at 6 months, we are going to start offering some meats. So we want to target iron because remember we're a nutrition program, so we're focusing on foods that age group needs. So we're giving some meat, some fruits, vegetables, and some grains for the infants at that point. So yeah, it is a special. And also I should tell you, for food packages, if you have multiple babies, you get even more.
Exciting. Thank you.
Even more food. I'll take you to the next. So we have six brand new nutrition rooms, and that's what's going on here. Here's a peek at one of them, and you can.
I like the fruit on the doors.
Yes.
How cute.
They're all about healthy food. So this is Meredith, one of our registered dietitians. So we do offer nutrition counseling, and Meredith, so after the person moved through, got the income assessment and was on, then they would do the nutrition assessment. So Meredith would screen for nutrition risk, provide nutrition education. Meredith would tailor the food package based on preferences. So we have non-dairy options, we have kosher options, we have if you are someone who doesn't have access to a refrigerator, we can tailor the food package so you don't have perishable items. Am I missing anything?
No, so we really just go through the food items that we provide and assess for the need for referrals and whatever type of counseling or coaching is needed.
How do you like the new space?
It's great. Lots of sunlight, big, spacious.
I know, the whole family can fit in here.
Exactly.
It's enough room for
private, right?
Yeah.
And have,
multiple babies, children.
Yes, keep coming with all your children. Bring your children.
Thank you, Meredith.
Yeah, and so this continues down here, and 6 new rooms.
Nice.
Banana, carrot. So, and Meredith touched upon it. She talked about referrals. So WIC, in addition to offering nutrition counseling and food package, we are a tremendous referrals resource. So we can refer you to early intervention, to other food assistance programs, to Medicaid, to SNAP, to we have housing referrals. We have
I think a farmer's market.
Yeah, let's talk about farmers markets. It's almost June. My
Yes.
goodness. Yes. So every June we start our farmers market. So what does that mean? That means in addition to the monthly fruit and vegetable allocation, and if some of you may remember that up until the pandemic, a monthly fruit and vegetable. We used to call them vouchers before we were electronic. Now we're electronic. It would only be $9 for children. That is now $25. $25.
Wow.
It's a permanent change. So $25 for children. Pregnant women are getting I think it's $44, and breastfeeding women are getting $47 every single month. It's huge.
Wow.
This is a permanent positive change that we're very excited about.
Wow.
Yeah.
Thank you.
Yeah. So, so WIC is, and I do want to say something, Raina. Very often we hear, I'm not going to, even though they're eligible, they say, I'm not going to come to WIC because I don't want to take it away from somebody else. And I want to speak directly to you. You are not taking it away from someone else. So what happens is, there is a eligible assessment, right, based on the number of people who should be on such a program, WIC. And if we don't meet that number, it has to go back to the federal government, and they say, "Oh, New York doesn't need it." So don't feel you don't have to be desperate. You just have to meet the eligibility. Like I said to you, you could be working. Many people are, and still qualify, and you're not taking away from anyone else. In fact, you're preventing the resources from going back to the feds. Keep it in New York.
Keep it in New York.
Yeah.
We love that. Keep the money here.
Keep it in New York.
Love it. Thank you, Helene. Let's see if we have any questions. Let me ask my studio guy. Do we have any questions in the Facebook Live, Phil? Let's see. I don't see any questions that came in just yet. Just tell me maybe 3 things that everyone should take away from this Facebook Live video.
Okay.
What are your top 3?
Top 3 is that WIC is an amazing program, and I wish that WIC was available for everybody, right? Everybody. So you definitely want WIC. If you know somebody who's pregnant or a child under the age of 5 or an infant, you are not taking away resources from someone else. We're here to serve you, and you have at your fingertips a caring, dedicated staff who is here to help support your journey, your parenting journey, give you the food you need, give you the tools you need to have a healthy pregnancy and raise healthy children.
One last thing, if anyone is interested in signing up for WIC, if they're interested in signing up or just learning more information, wanting to schedule an appointment, how should they do that?
Yeah. So you can go to our website, so WIC at Ryan Health, and you'll see a little apply button. So you could just push that, and we just ask for like a little bit of information so we know how to contact you. So that's a great way. Or you can call us. I want to say that when you call us, if the message machine picks up, leave a message. It doesn't mean that we're not going to call you back. We call everyone back usually honestly within 2 hours.
And what's the number?
So it's, Paloma, help me out. 212.
It is 212-865-0410.
212-865-0410.
Awesome.
So leave a message. We will call you back if we don't answer directly.
All right, sounds good. Paloma, thank you. Meredith, thank you. Thank you so much. You guys can see me a little bit. Well, stay tuned for the next Facebook Live. More to come. Thanks, everybody. Bye.